Hello and welcome to our show today. I'm Jamie Smith, Cancer Control Specialist with the Kentucky Cancer Program. As many of you know, Western Baptist Hospital is now Baptist Health Paducah. The name may have changed, but the care is still the same and getting better. The addition of a breast nurse navigator at the Center for Cancer Care has been created to better serve those diagnosed with breast cancer. Baptist Health Paducah is dedicated to providing top quality cancer care, and this addition to the cancer program demonstrates that commitment. I'm joined today by Terri Walters, a nurse at the Center for Cancer Care at Baptist Health Paducah, who is also the new breast nurse navigator. Thank you for joining me and welcome to our show today.
Thank you.
If we could just first start off, just tell a little bit about yourself and what exactly you do there at Baptist Health Paducah.
Well, I've been a nurse at Baptist Health Paducah. That's something new that we have to say now. For 30 years. I have been in oncology for the past 18 years, specifically radiation oncology.
Okay, perfect. And then let's talk a little bit about the cancer care there at Baptist Health Paducah before we actually get into your new role. We've talked about the commitment to cancer care at Baptist Health Paducah. Can you tell us a little bit about the accreditations that the program actually has there at the hospital?
Well, in cancer care, our hospital is accredited by the Commission on Cancer, COC. What this means is that we're in a group of professionals, organizations that are dedicated to improving survival as well as treatment for the patient and quality of life. There are over 50 national organizations that are a part of this COC. Just a few of them, some people might recognize: the National Cancer Institute, Center for Disease Control, the VA, the American Cancer Society, the NCCN is National Comprehensive Cancer Network, and the ACR, which is American College of Radiology. Those are just a few, some people might recognize it, that are in with the Commission on Cancer. The organization group will set up standards through prevention, education. They'll help with education and research, monitoring, to make sure that our patients have the best quality of care. Specifically, in the area that I am in, our hospital is accredited as a breast imaging center of excellence, which is obtained through accreditation of our breast ultrasound, our breast biopsy, and then our mammography services.
Okay.
The accreditation requires very high standards for our technologists, for our radiologists that read them, and the machines that they use, all the equipment. Our imaging program also is MQSA guidelines, follows those guidelines, and that stands for Mammography or Mammogram Quality Standards Act.
Okay.
Now, this program is driven by the FDA, and it's very, very strict. It requires on-site annual inspections. It's high standards for the technologists, high standards for the radiologist, and again, the equipment as well. They have quality checks that they do every day, every week, every month, and then twice a year.
Okay.
Every one of those are different, so lot of extra work that is done behind the scenes that patients don't know about. Baptist Health Paducah also holds accreditation for American College of Radiology, and again, that's in with a partner of the COC. There's several modalities in imaging that are accredited by the ACR: mammography, ultrasound, PET scan, MRI, nuclear medicine, stereotactic biopsy, and radiation oncology, and we just were reaccredited. We have been accredited since 1996, so that's a long time for an accreditation.
Yeah, that's great.
They're every 3 years, and the reason that hospitals do accreditations and are certified in certain areas is to communicate to the people in the community, to our patients, that we have a very high standard of care, and that's very important to us. And our goal is to make sure to provide everything that we can that's best for the patient, from the technologists that are performing it to the radiologists that are reading it, to the equipment that is used to obtain high quality imaging.
Sure. Well, part of this accreditation includes your new role at the hospital. This was a standard they introduced a few years ago and gave the hospitals a few years to implement some of these. So we know that a cancer diagnosis is overwhelming for anyone, for sure.
Absolutely.
What does the addition of a nurse navigator do to help someone overcome these emotions if they are newly diagnosed?
Well, Jamie, the main thing that I want patients to know is that I am there for them. They are free to call me at any time. First, patients are given information that they have cancer. Mm-hmm. That's a devastating thing to hear. Then they go through all the phases of denial, shock, anger. They go back to denial again, back to anger. They go through all these emotions, and they're so bombarded with all this information. They talk to the surgeons, they talk to the medical oncologist, the radiologist, the radiation oncologist, and a lot of times they might miss some information or misunderstand it, and that's where I come in. I review the information that I have received about the patient, and then I try to answer any questions having to do with their treatment process. I have the physician's notes. I'll explain schedules, the treatment side effects, what the process is, things like that. If I don't know the answer, I can always find out.
Okay. And I think it's important to people to know that you're actually on site there at the hospital, you know, so you can go anywhere within that hospital, right? You're not
Absolutely.
Just restricted.
My office is at the end of the radiation oncology department. The BIC, I think, is 1.2 miles that way, and I walk it probably 3 or 4 times a day.
Great exercise then.
I'm getting my exercise.
Well, that's great. So you get some fitness into your daily activities too.
Absolutely.
Well, what kind of training did you receive already for this position? And I know you probably have a few more trainings you have to go through.
Absolutely, yes. I will be attending a breast health navigator training that's going to be in Atlanta, Georgia at the end of this month. The instructors are a woman that's a nurse, Judy Neese, and a physician, Dr. Ruth O'Regan. Judy Neese happens to be a member on the ACOS, which is the American College of Surgeons National Accreditation Program for Breast Centers. That's a long that's a long organization name, but it's a very prestigious one. So this is I really am looking forward to this, getting a lot of information from this conference. The conference will teach all aspects of breast health, benign as well as cancer, breast cancer treatment, survivorship. They specifically try to help navigators that are starting programs like we are doing.
Okay.
In the hospital, I have been training, observing in all areas pertaining to breast health. I've been watching the mammography girls, ultrasound, I've been observing biopsies, surgeries. I have learned so much from the staff. It's just amazing. You're in the hospital for 30 years and you don't know what's behind closed doors just down the hall. But they're very excellent, very professional. They have a wealth of information. I found out that the ultrasound techs have 70 years of experience. The mammography techs have over 100 years of experience. The radiologists that read the mammograms have over 170 years experience. That's a lot of expertise just in one place.
Absolutely. And even the evolution of the equipment that they're using, I'm sure now even gives them greater expertise, because technology certainly come a long way. In,
it has.
I mean, just a short period of time, even 40 years ago, what the mammography was is certainly not what it is today.
Yes, that is true. We had a patient come through, had a biopsy, but she had never had a mammogram, didn't want one, just would take the biopsy and that's all. Talked her into getting a mammogram, and she said, well, that wasn't bad at all. And she and the mammogram tech were best friends. By the end, they knew family members and friends, so the girls are really great. I
think there is some fear there for some women. They worry about pain and things like that, but the equipment today is not what it used to be, and it shouldn't be a painful experience for women. And if it is painful at all, you need to let the technician know, because they obviously need to reposition so that they can get a clear picture.
They have pads that are on the machine now, and you know, they tell their patients, this should not hurt. If it hurts, you tell me.
Right, right. Well, I think that that's great, especially just to let women know that they can just talk to the technicians.
Yes,
and
yes.
they'll take great care of them.
They are very good.
About how many cases of breast cancer are diagnosed then each year at Baptist Health Paducah?
We have about 150 cases diagnosed approximately at our hospital each year.
I know that some people may think that that's not a extremely large number, but I think for our area that is quite a bit of cases that you're seeing then for breast cancer. And definitely 150 cases per year will definitely keep you busy.
That will keep me busy, absolutely.
One question I always get when I'm out in the community, and of course we do a lot of breast cancer health education, and you know, people always say, well, men get breast cancer too. So I'm sure a lot of people are out there asking this question. Are you only going to serve women in the hospital, or are you going to serve men if they're diagnosed with breast cancer as well?
We absolutely will serve men that have breast cancer. While I've had very few men with breast cancer, we have treated some when I was in radiation oncology.
Right.
I'm thinking 2 or 3. They still have the side effects that the women have with the skin reaction, and they still need help with direction going through the health maze that they have to go through nowadays. You know, certifications, and you know, is it okay if I do this with my insurance? So many questions, and things change all the time. And
I think for a man too, if he was diagnosed with breast cancer, I mean, it would just be complete shock and you know, no knowledge of anything. You know, where do you start? Where do you go? At least women, you know, a lot of them have friends that have already had breast cancer, or know someone at least that has had breast cancer and know what general direction it might go in. But a man just may feel like he's kind of alone and doesn't have any knowledge at all. So it'll be interesting to see how your role plays a part in that with men. Let's talk then a little bit about how the person actually comes in contact to you. As a person is newly diagnosed, when and how are they actually connected to you within the hospital?
Well, tumor registry, our tumor registry does a lot of work in the cancer area. They get the pathology report, any positive pathology report, and then they forward it to me. Also, I will be spending a lot of time in mammogram, just meeting the patients. Right now I'm still observing a lot. But what we want to do is try to catch some of these women that might have an abnormal mammogram. The radiologist has recommended that they have a biopsy, and that's where I might be able to come in and say, look, you know, he's recommended this. What do you think? Would you like me to call your physician and see if we can go ahead and get that started? Sometimes we have options that, you know, if they would like to get it done faster than choosing a surgeon and then going to the surgeon and then coming back and having the biopsy, that maybe we could get it done faster.
Okay. So as you come into that first meeting with a newly diagnosed patient, what exactly are you doing within that first meeting, and what exactly are you going to do for that patient during the course of treatment and into survivorship?
Well, Jamie, it depends on the diagnosis of the patient. First is education. Everyone will get a packet with a booklet on breast cancer. Resources that our hospital has, resources that our community has. There's a, you know, that pretty much is general. Our surgeons are very thorough in Paducah, and they've done a lot of educating already before I see them and talk to them about breast cancer and their upcoming surgery. Where I come in is that maybe they've had a question that they forgot to ask the doctor, or they thought about afterwards, and then perhaps I can answer those kind of questions. I'll give anatomy and pathology pamphlets out to them. We'll kind of review the breast, the way the breast looks, what the normal, what the abnormals are. We'll talk about surgery, radiation therapy, just depending on, you know, chemotherapy if they're supposed to get that kind of treatment. Each patient is different, so the education piece is going to be different. Some people may have a mastectomy and that's all. Some people may have a lumpectomy with radiation. There are others then that may have chemotherapy first, then surgery, then radiation, then more chemotherapy. Some will get hormones, some may not get hormones. So depending on that particular woman, that's the type of information that I will cover with her. That's the first thing. The second thing is I'm going to do a little psychosocial tool screening. Just very short, very small, but just to kind of give me an idea of where she's coming from, where she needs help. Sometimes just talking to me is enough.
Right.
But others might want to have a visit with a chaplain. They might want somebody like a psychologist to come talk to them. If they are apprehensive about finances, I can counsel them. I wouldn't counsel them, I would refer them to a financial counselor or a social worker if they're having issues at home. There's all kinds of referral areas that I can send them to if they're having problems in that way. The third and final thing that I will do is do a survivorship care plan for them. And this is a summary that the COC is now going to start requiring to keep the patients that are finished with treatment from getting lost. You need to keep up with them. So many times, you know, they finish treatment, they say, okay, we'll see you in 6 weeks. You see them in 6 weeks, and then now what do I do? You know, they're kind of lost. Who do I call? Do I call my surgeon? I've got this problem. Do I call the medical oncologist? Do I call the radiation oncologist? So they're a little confused as to who to notify. So the summary that I will give them will include contact information, treatment summary, recommendations for follow-ups, testing, support, community support, counseling, things like that. The purpose of the standard is, you know, as I said, to help them keep from getting lost in transition. Just because you finish treatment, that doesn't mean that you know, don't need help anymore. They need to know how important follow-ups are. They need to know that they will have breast exams when they come back, and they will have mammograms when they come back. They need to be told about things that can happen afterwards, like if they had treatment to their left breast, this left arm needs to be treated more meticulously. If you have an infection, that needs to be jumped on more than somebody that has not had breast cancer on the left side. They need to know about lymphedema. Lymphedema is when you take away some of the lymph nodes. There's sometimes some backlog and they can get some swelling. And lymphedema is something that you need to start treatment at that time. You don't need to wait. And Baptist Health Paducah is going to be having a lymphedema therapist toward the end of the summer of 2013.
Okay. And sometimes too, they can't have blood drawn out of an arm after cancer treatment.
That's true. That's true.
So
blood pressures they would rather have on the other side, just to try to keep that arm babied, because it is more susceptible to things like infection and such.
Okay. I know that you did talk a little bit about some of this, but the treatments that they can get there at Baptist Health, you talked about surgery and radiation and chemotherapy, and those can all be done there at the hospital, correct? Correct. And you have the cancer center, if you would just kind of tell people a little bit about that, because not every hospital has that.
That's true, that's true. The surgery can be done at our hospital. Our radiation oncology department has been in existence for 25 years. I've been here 30, and they've been doing chemotherapy ever since I've been there. I don't have an exact number on that. Any kind of service that you would really need for breast cancer, we have.
And you have an oncology floor there at the hospital as well. Do they do treatment up on that floor, or do they send them down?
Yes, they do. Insurance is changing a lot of things back and forth, so there are some patients that will get chemotherapy that are in the hospital on the floor. We also have an outpatient chemotherapy department, and they can get outpatient chemotherapy as well, and that's right there by our radiation oncology department.
Well, let's talk a little bit about hormone therapy then. I know that you mentioned it earlier, but let's actually explain to the viewers what hormone therapy is. They may think it's some sort of treatment they get at the hospital, and let's kind of clarify that for the viewers.
Some cancers for breast cancer are fed off of hormones. And so the first thing the physician will do is stop their hormones if they are on that, and then put them on another type of what we call an anti-hormone. And sometimes they stay on those for several years. depending on the age, whether she's premenstrual or postmenstrual, depends on which hormone they put them on.
Right. And I think on average, typically, it's about 5 years, but it can be different.
Yes,
But
yes,
that seems to be what the
5 years.
average is.
Yes.
How does the nurse navigator help prepare the patient for each step in treatment then? I mean, you can't do that all in just one meeting with them, correct?
That's true. That's true. At the very beginning, I'll try to check with them during the period of time when they're having surgery. If they're not having any, I'll just make a call. Are you doing okay? Do you need anything? Or you have any questions? If that's fine, they'll go through, let's say chemotherapy is next. I'll check with them again. Are you having any problems? Same thing with radiation therapy. If some people are after surgery are having problems, cosmetically, make sure that they know that there are businesses in town that can help them with breast forms, camisoles, bras, and Medicare and insurance does pay for a lot of these. That's something some women don't know, but there are businesses in town that can take care of that. Also, say in chemotherapy, if they're really having trouble, say with transportation, they're getting weak, all their family members work, they need some help. Baptist Health Paducah has a wonderful van system. Our transportation system is just great. We've got a couple of guys that drive back and forth. If the patient is not from the Paducah area and our range is 50 miles, then American Cancer Society has just recently trained new volunteers. And I'll have to look on my list here, but they have just trained 6 drivers at Graves County. There's 7 or 8 now in McCracken County, 8 in Trigg County, and 5 in Crittenden County. So if people are getting treatment and having to drive all that distance, there are volunteers in their community that will be able to help them.
That's great, because transportation is a huge issue, especially today, and so to know that there's somebody that cares enough to be able to drive you to and from treatment can take a great burden off of them and, of course, the caregivers as well. That was one thing I did want to ask you, too. Whenever you're meeting with some of these patients, especially right after the diagnosis and it is a little overwhelming, are there caregivers in the room with you that are, part of the treatment planning process with the patient?
You mean whenever they're getting their treatments?
Well, whenever you're sitting down with them and giving them out information, can the patient have the caregivers in the room with them?
Oh, yes, yes.
Some people worry about that.
Yes, absolutely. If they come to see me, I've got a fairly good size office now, and if I don't have enough chairs in mine, then I'm going to go outside and pull chairs in. But I am, if grandma wants to come, and the daughters and the uncles and grandpa, whoever wants to come, they can come.
Great.
The more the better, because what I find is that sometimes if you have only one set of ears, they might forget. You got another set.
Better luck in hearing it.
You might get more information out of that. Third, that's even better.
Yeah, at least somebody hears something.
Yes.
Well, how can a person contact you to find out more information about what exactly you're doing there?
Well, my specific number is 415-7631.
Okay.
That's a 270. We also have a number for our Cancer Care Center, and that is 575-2780.
Okay.
Baptist Health Line, which is the general one, yes, and the nurses there are wonderful. I've used them for my sick kids before and other questions that I don't know about. Their number is 575-2918.
Okay. And the great thing with that one is, too, if they don't answer, you leave a message and they call you right back.
Yes.
It's good.
And they do call you at 2 in the morning, too.
Yeah, they do. There's always someone there. And one thing we do want to let people know, we mentioned this earlier, but through the whole process, you stay with them from start to finish into survivorship, and even after they're done with treatment, if they still need you, you're still there as a resource.
Absolutely, yes. If a patient, say, I just had one that had a mastectomy. She had already had surgery for breast cancer on one side, now the other side. She had now going to be bilateral mastectomy, no radiation, no chemotherapy. She was done. That was it. I saw her a few times, and then we were finished.
Okay.
She can call me at any time. I have another patient that is going to go through the whole process with chemotherapy first, then radiation, or excuse me, then surgery, then radiation, then possibly more chemotherapy, I might have her for a couple years.
Okay. Well, let's just tell viewers then when people should actually begin their mammography screenings. We want people to, if they're going to be diagnosed with breast cancer, we want to find it early. So what age should they start?
The American Cancer Society and the American College of Radiology recommend 40 as the age to start your annual. There are some physicians that do want to go ahead and start between the ages of 35 and 40.
Okay. And let's give the numbers one more time for you, if they want to call you, your direct line.
For me is 415-7631.
Okay. And then the cancer care?
And the cancer care number is 575-2780.
Okay.
And the Baptist Health line is 575-2918.
All right. What else do you want viewers to know out there today, Terri?
I am a free service.
That is a question I'm sure people will ask. They will ask if their insurance gets billed for you, or...
I am a free service.
That's great. Great. Well, thank you so much for joining us today.
Thank you for having me.
We appreciate the fact that Baptist Health Paducah takes great commitment and high quality standards to cancer care in our area, and people don't have to travel away to get cancer care. They can get it right here in our area.
Absolutely.
So we want people to know that.
Absolutely.
Well, thank you for joining us today. And if you have questions about today's show, you can either call Terri at Baptist Health Paducah, or you can call our office, the Kentucky Cancer Program, at 442-1310. Thanks for watching and have a great day.